Okay, so we've done a couple videos with the Proactive Protekt Aire 7000 lateral rotation air mattress, and we're kind of going through some tutorials, and I'm going to do a second video now on this and just kind of walk you through. If you've got the mattress, obviously there are instructions, but I'm not one of the guys that likes instructions per se. I kind of like to just figure it out as I go. And since we've sold a lot of these, I've kind of learned how to do this. And I prefer watching videos or just calling somebody. And I'm not saying that that's what you should do, but I'm just being completely honest with you. So there's a couple things that I want to explain real quick. First off, with this mattress, if you need to use anything, the first thing you do is you press lockout for 3 seconds. Now you see that just went off. You can adjust the firmness. We're running the full turn cycle on it right now. So basically that means it's going to turn left, turn right. But if you wanted to just turn left or you wanted to just keep them to the right, you'd be able to do that, obviously. And then here with cycle turn, if I keep pushing this, I can determine how long it's going to be that the cycle of the turn is going to go. Now, the other thing that we've got here is we've got two other features. We have alternating pressure, and we have static, and we've got pulsate. So basically what I'm going to do is I'm going to move it over to static. Pulsate, what pulsate does is it reduces the air pressure in the mattress. It allows the person to sink all the way down. So they literally drop all the way down. And then what it does is it firms up the mattress. And so pulsate is really there for pushing and stimulating blood through the capillaries. So it's really there, that pulsate features to help circulate blood through the body. And so there might be times where you need that. There might be times when you don't need that. But if you wanted to know what pulsate was, that's what pulsate is. Static right now is going to be something I'm going to use. I really don't want to do pulsate while I'm doing the turning. It would be easier to just do pulsate and then do the turn. So I'm not really gonna set that up or do it that way. The firmness of the mattress can be controlled by the person. Okay, so I don't normally recommend that you've got it cranked all the way out at 660. Usually somewhere between the 2.0 and the 3.0 here are going to be the ideal areas. You can soften it, you can firm it. But one thing that's nice about the mattress is you can adjust the firmness of the mattress based on what it is that you want. The other part of it is that alternating pressure on this mattress system, if you can see, well, you can't, but across the top here, there's 18 air bladders that start at the head, come down to the foot. And alternating pressure is going to alternate each module. One will be on, one will be off. So one air baffle will inflate, one will deflate, inflate, deflate, and then it'll cycle and do that again with the other opposite air baffles. And technically what that is there to do is it's there to basically change the part of the body that's making physical contact with the mattress. So when you're doing that, you're basically changing what part of the body is touching the mattress, because the air baffles are alternating as far as which one's full and which one's not. Now, there's a couple features on here that are really important for you to see. And I want to go through those right now. And I didn't do it on the first video, so I'm going to do it now. Now, you can see here we've got these air baffles, okay? Now, the air baffle that goes around the end of the bed or around the bed is here to protect the person. So when they're doing the turn, they're turning them softly into a padded surface, okay? Also, if there's a risk management of people falling out of bed, this is going to keep them more centered into the bed. Now, this feature, this air bladder here, is controlled down in the corner by this valve. And this is an important part for you to see. So this is called the bolster, okay? This is the bolster pad, just this pad that goes around the outside. And you've got this valve here, and this valve is going to say open, and it's going to say close. So what I did is I've closed it, but if I lift this up, and I don't think I can do it with one finger, but when it's time for the person to get out of bed, all you do is lift this up and turn it down here and put it into the open. So when you open the bolster, what it's going to do is it's going to deflate just this baffle going around the outside, And obviously, it's going to make it easier to get the person in and out of bed. Okay. Now, there is another one down at the other end of the bed that's for the CPR. And so you do have a CPR, another one exactly like this, except it's red, and it's going to work exactly the same way. So if you get the mattress and it's saying LP, which is low pressure, basically what's happening normally is that this baffle right here is not closed, it's on open. When it first comes, it's going to come in the middle, and you can determine open or closed. But what you want is you want to open it up, obviously, to get the person in and out of bed. And then once they're in and out of bed, you want to go ahead and then close it back up. The same valve is on the opposite, or up here at the top, like I was saying, and that's for your CPR. So if you ever had to do CPR on somebody, you want the mattress flattened out. It's going to push the air out of the mattress so that you've got the ability to go through and do CPR. But when it comes to getting the person in and out of bed and doing it in a way that's going to be a lot easier to do, you're going to want to go ahead and just lift this up and put it from open to closed. And sometimes what happens is if the mattress is saying, hey, we're low on air, it's saying that because you've left this open and it's been open for a while. So the mattress itself is basically waiting for the thing to be closed in order to fill the mattress back up again. So with the Proactive 7000 air system, the Protekt, like I said, you've got the firmness controls, you've got the multiple features here, which are your alternating pressure, pulsation, and then we've got it on static. Static is the best one to run it for if you're doing the lateral turning. And then also, like I said, if you just say, look, I want to change out the bed linens, or we need to change the person, technically you could, at 35 minutes probably get that done. But if you just wanted to keep them on the right side or the left side, you have the ability to do that. Sometimes people, recovering from a stroke might be partially paralyzed on one side, so you want to turn them over on the other. Once again, you have the firmness controls. And the lateral rotation, which in normal terms would be called patient turning, is really a huge feature because, I've said this in many videos, caregivers are injured on the job a lot. Nurses are number one when it comes to workman's comp filings, being injured trying to turn people that a lot of times are immobile and, having to bend over the bed and go through and doing all that. And they might, if this is a facility that doesn't have lateral turning mattress systems, you can imagine these caregivers have to go up and down the halls turning people all night long, which over a prolonged period of time, if you just get in the wrong position at the wrong time, or if it's a heavier patient and a smaller nurse, you can kind of figure that part of it out. So if you're looking for a really great air system that has lateral rotation, the Proactive Protekt Aire 7000 is really one of the best. I would call it a starter. You can get into higher grade systems. And the reason I would say higher grade is simply because there's primarily this system right here runs low air loss. But it does need 15 minutes on and 15 minutes off. So it runs low air loss. It's a high-end home care style mattress system. When you get into hospital grade care, the pump is going to be bigger. It's going to push more air, and the low air loss is nonstop, meaning it's not going to need 15 minutes to recharge. Now, low air loss on the far left and the far right, there's little holes in these air bladders. There's air bladders that go from the top of the head to the bottom of the foot. And on each side of those is little tiny holes that release air. And what that does is it circulates over the surface of the mattress and it whisks away moisture to keep skin dry. Bed sores are really something to avoid. If you're starting to see signs of that, you want to get after that right away. Bed sores can get out of control very quickly. It's the number one reason people get readmitted into a hospital is there's some type of skin breakdown. So our goal here is prevention. But once again, when you've got a mattress like this, which has lateral turning, it's going to push a lot of air over the surface. A nonstop low air loss would be you know, a higher price bracket, and sometimes you might need it, sometimes you might not. But you know, when it comes to really super high quality mattress system, this is a good one. And as you can see here in our showroom, we've got, you know, we've got so many different beds. You know, we've got the striker beds, we've got drive beds, so we can take the Aire system and we can put that onto other Aire or other bed surfaces. This is the Proactive mattress and the Proactive bed frame. And this is called a high-low bed frame, so it'll go low to the ground so people in wheelchairs can get in and out of bed. You have optional rail designs, but we've got the pivot rail, which makes it easy if you just need a handhold to try to get out of bed at the end of the bed. You still have plenty of room to get out here, and we can get more into the bed stuff later. But this is just a follow-up video to kind of just run through again and just show you a couple more things about that Proactive mattress. So for more information, you can go to our website, Mr. Hospital Bed, mrhospitalbed.com. You can go to hospitalbedshop.com, or better yet, just call us. You can reach us at our San Diego location at 858-263-4894. In beautiful Richmond, Virginia, you can reach us here at 804-495-0770. Once again, we're looking at low air loss mattresses, mattresses with lateral rotation, the Proactive Protekt Aire 7000. Definitely one of our top sellers. This is really a great mattress because it comes in a lower price point, but still delivers a lot of function, a lot of benefits, and it's reliable, durable, comes with the full warranty. So for more information, subscribe and share. Thanks for watching the videos, and we'll see you on the next one.